All right, so get ready, folks. We're about to take a deep dive into something you probably don't think about too much, but use constantly, your knees.
Yeah, they're pretty amazing when you think about it, right?
Right. And we've gotten some fascinating listener sources on knee anatomy and what causes knee pain. We're going to break it all down.
Sounds good.
So picture this, you're walking up a flight of stairs. What's going on in your knee with each step?
Well, let's start with the bones. They're the framework, right?
Like the femur.
Exactly. The femur, longest and strongest bone in your body.
Wow, I didn't know that.
Yeah, pretty impressive. So you have your femur up top, and then the tibia. That's your shin bone.
Okay, and of course the patella, the kneecap. It always seemed like a shield to me, just protecting the knee.
Well, it does that, but it also acts like a lever.
Ah.
Increases the power of your quadriceps muscles when you straighten your leg. So it's not just protecting, it's helping you move.
Huh. So the shape of those bones is really important then. But what keeps them from, like, grinding against each other?
Cartilage. It's like nature's lubricant. Keeps things moving smoothly.
Oh, yeah, and there's two types of cartilage in there, right? I remember reading about that.
You got it. There's articular cartilage, which covers the ends of the bones where they meet. Makes for a smooth surface.
Like Teflon or something?
Perfect analogy. And then there's the meniscus. C-shaped. Acts like a shock absorber.
The meniscus, I remember reading about those little cushions.
Exactly. And here's a fun fact. They're actually remnants of leg muscles from way back when, evolutionarily.
No way. Seriously. So they're like ancient muscles turned into cushions.
Yep. And without them, all that impact from running and jumping would go straight to your bones. Ouch.
Yeah, ouch is right. Okay, so we've got bones, cartilage. What else is in there?
Ligaments. They're like strong cords that connect the bones to each other, keep the knee stable.
So they're like support beams, making sure things stay in place.
Exactly. And I'm sure you've heard of the ACL, the anterior cruciate ligament.
Oh, yeah, the dreaded ACL tear.
Right. It basically acts as your knee seatbelt, prevents the tibia from sliding too far forward. So important for stability.
Especially in sports, right? All those sudden movements.
Totally. And if it tears, it's like losing your seatbelt. Then you have the PCL, the posterior cruciate ligament, which does the opposite. Stops the tibia from sliding too far backward.
So the ACL and PCL are like front and back guardians.
Exactly. Keeping everything in line.
Makes sense. But what about side to side? What keeps the knee from wobbling that way?
Good question. That's where the MCL and LCL come in. The medial and lateral collateral ligaments. They're like ropes on the sides, preventing it from bending the wrong way.
Okay, so those are the side supports, keeping the knee on track.
You got it. And together with the ACL and PCL, they create this really strong and stable structure. Lets us move confidently.
Wow, I'm starting to get the picture now. We've got bones, cartilage, ligaments. What's missing?
Well, we need power, right? We need the muscles and tendons to actually move the knee.
Right. All those other parts can't move on their own. It's like a car without an engine.
Exactly. Muscles are the engine, and tendons are what connect them to the bones.
What are the big ones, the ones we should know about?
Well, your quadriceps and your hamstrings are the stars of the show. Quads are at the front of your thigh. They straighten the knee. Think about kicking or standing up.
Okay, so quads are like the go muscles. What about hamstrings?
Those are the back of your thigh. They bend the knee. Think of them as the brakes,
Right.
controlling the movement.
So it's like a gas pedal and brake system.
Yeah. And the quadriceps tendon is super important because it connects those quads to the patella, and then the patella is connected to the tibia by the patellar tendon. That whole system is how your knee extends with so much power.
Wow, we've got quite the team now. Bones, cartilage, ligaments, muscles, tendons. That's a lot of moving parts.
It is. And they all got to work together. If one's out of whack, the whole system suffers.
Makes me appreciate my knees even more. So remember that stair climbing example?
Oh, yeah. I bet we can picture it all now.
So you go to take a step up onto a stair. What happens first?
Well, your quads contract, which pulls on that patellar tendon, and that pulls on the patella.
Which pulls on the tibia, and the whole knee straightens.
Exactly. And as that's happening, the femur is gliding over the tibia thanks to the cartilage.
And those minutiae are in there too, absorbing the shock.
Right. And the ligaments are working hard, keeping everything stable.
It's like a perfectly choreographed dance, huh?
Exactly. Every part playing its role. And when one dancer is out of sync, well, that's where the problems start.
Which brings us to knee pain.
Right. And we'll get into all of that after the break.
Stay tuned. We'll be right back with more on what happens when those dancers get out of step.
All right. So we've built the knee, all those parts. But what happens when things go wrong?
Yeah, when those dancers, as you put it, get out of step.
Right. And it's amazing how a tiny thing, like a little misalignment, can cause big problems.
Speaking of misalignment, one of the sources talked about how if the tibia, the shin bone, gets pulled back too far, it can mess with the kneecap.
Yeah, the position of the tibia is really important for how the patella tracks. If the tibia is pulled back, it puts stress on the tendons that connect to the kneecap.
And then
And then the patella can start rubbing against the femur.
hard, no kidding. So it's not just the bones, it's how they all fit together.
Exactly. And misalignment can also cause uneven loading in the joint.
Like some parts are taking more weight than they should.
Right. Say someone's knee bends outward. That can put way too much pressure on the inner part of the knee, especially the medial meniscus.
Shock absorber.
Uh-huh. And if it's always under stress, well, it can tear or wear down, like cartilage does in osteoarthritis.
Sounds like misalignment is a recipe for disaster.
It can be, yeah. But even with perfect alignment, there's still wear and tear. It's just
Right.
going to happen over time.
Yeah, aging, right. We can't escape it.
Nope. And as we age, the cartilage starts to break down. That smooth surface we talked about, it gets rough. That's why osteoarthritis is more common as we get older.
Makes sense. So it's like that Teflon analogy, but the coating's wearing off.
Perfect way to put it. And without that smooth cartilage, the bones rub against each other. Pain, stiffness, inflammation.
Not a good combo. What about tendinitis? The sources mention that a lot. Is that an aging thing too?
Not always. Tendinitis is when a tendon gets inflamed.
Yeah.
It can happen anywhere, but it's common in the knee, especially the patellar tendon.
The one that connects the kneecap to the shin bone.
That's the one. It's called jumper's knee sometimes because it's common in, well, jumpers, basketball players, things like that.
So overuse, basically. Too much stress on the tendon.
Yeah. All those tiny tears that come from repetitive stress, they cause inflammation. But it's not just athletes who get it. Anyone who overuses their knee can.
Right, because even just walking up and down stairs is a lot of stress, huh?
Totally. And speaking of repetitive stress, there's IT band syndrome. Runners get that a lot.
Yeah, I've heard of the IT band. What is it exactly?
It's this thick band of tissue, runs along the outside of your thigh from your hip to your knee.
Like a support band almost.
Yeah, kinda. And if it gets too tight or inflamed, it can rub against the knee. Painful. Runners get it a lot because their IT band is constantly moving with every stride.
Right, right. So we've got misalignment, wear and tear, and overuse injuries. What about like sudden injuries? Those seem different.
They are. We call them acute injuries. Can be anything from a little twist to a full-on tear.
Like an ACL tear, that's got to be a sudden one.
Oh, yeah. Common in sports with lots of quick direction changes. A twist, a pivot, foot planted wrong, and pop torn ACL.
Can't really walk around with one of those.
Nope. The ACL is a big stabilizer, and when it's gone, your knee can just give out. Surgery is usually the answer, and then a long recovery.
Yikes. And I think the meniscus can tear too, right?
It sure can. Suddenly, like with a twist, or gradually as it weakens with age. The sneaky ones are the gradual ones. Hard to know they're even happening.
And those tears, I guess they cause pain too. And maybe limit movement.
Absolutely. That torn piece can get caught in the joint, causing it to lock up.
Ugh, that doesn't sound fun. So tears to the ligaments, tears to the meniscus. What about broken bones?
Fractures happen too, yeah. Usually a direct blow to the knee. The patella is the most common one to break.
Ouch, I bet.
It's not fun. And then there's the most severe one, dislocation.
Dislocation. That sounds scary.
It's not good. That's when the bones get forced out of place. Patella, or sometimes the femur or tibia.
What would cause that?
Big force, usually.
Yeah.
Car accident, a fall. Definitely need a doctor for that one.
Wow, we went from aches and pains to some pretty serious stuff there. The knee is one complex joint.
It is. And all these issues we talked about, they can overlap. One problem makes you more likely to have another.
So, like, misalignment could lead to a tear, for example.
Exactly. Or a tear can make the cartilage wear down faster.
So it's like a domino effect.
Yep.
One thing leads to another.
Exactly. And that's why it's so important to understand how the knee works. Knowledge is power, right?
So we can take care of our knees and prevent problems.
Exactly. And when problems do happen, knowing about the knee can help us make good decisions about treatment.
This has been, like, mind-blowing. I have so much more respect for my knees now.
Me too. And it's incredible how
Yeah.
resilient they are. All that stress day after day for years.
Seriously, we ask a lot of them. Walking, running, jumping, even just standing.
It really is amazing they hold up as well as they do. It's a reminder to take care of them.
Absolutely. So let's talk about that, how to keep them healthy.
Yeah, some tips and tricks to keep those knee dancers happy. What do you say?
Sounds good to me. We'll be back after a quick break to talk about how to keep your knees healthy and pain-free. All right, we're back. And I gotta say, my knees are feeling a little appreciated after all that talk about what can go wrong.
Right. Makes you realize how much we rely on them.
Totally. So let's talk about how to keep those knees healthy. Keep those dancers, as you said, in step.
Love that analogy. Well, the good news is there's a lot we can do. But first, we got to understand our own risks.
Like some people are just more prone to knee problems than others, right?
Exactly.
Yeah.
Genetics, lifestyle, all that plays a role. So the first thing is listen to your body.
What do you mean?
Pay attention to pain. Any pain, even if it seems small. Don't ignore it.
Because it could be a sign of something bigger.
Exactly. Catching things early is key.
Makes sense. So listen to your body. What else?
Well, weight management is huge.
Oh, yeah, I've heard that. Less weight, less stress on the knees.
Exactly. Every pound you lose is like a little vacation for your knees.
So even a little bit of weight loss can make a difference.
Oh, yeah, for sure. And then there's exercise.
Now, hold on. If your knee's already hurt, doesn't exercise just make it worse?
Not necessarily. The right kind of exercise can actually help a lot. Strong muscles support the joint, you see.
So like lifting weights?
Could be, yeah.
Yeah.
But it's more about strengthening the muscles around the knee, giving it that extra support.
So I guess it's all about choosing the right kind of exercise, right?
You got it. Low-impact stuff is great. Swimming, cycling, walking.
Hmm.
Get your heart rate up without pounding your knees.
And what if you like running? Like, I'm a runner, what should I do?
Well, moderation is key.
Yeah.
And good technique. That makes a big difference.
Right, good form. I've heard that's important. Oh, and one of the sources talked about warming up.
So important. I can't stress that enough. Warming up preps your muscles, gets the blood flowing, less chance of injury.
Easy to skip, though, when you're excited to get going.
I know. But trust me, it's worth those few extra minutes. And don't forget stretching.
Before and after, right?
Yep. Keeps things flexible, good range of motion, all that good stuff.
Okay, so wait, exercise, warming up, stretching. Anything else? What about shoes?
Oh yeah, shoes are big. Especially if you're active, you want good support, good cushioning. Helps absorb shock.
Like little shock absorbers for your feet.
Exactly. And of course, if you're already dealing with pain, there are things you can do. Over-the-counter pain relievers can help.
I always use ice.
Ice is great for swelling. And heat can help with more chronic pain. But if it's bad or it doesn't go away, see a doctor.
Yeah, could be something serious, right?
Right. A doctor can figure out what's going on and what the best treatment is. Could be physical therapy, medication, maybe even surgery.
So basically, we have a lot more control over our knee health than we think.
I think so, yeah. Understanding your knees, listening to your body, taking care of yourself, it all makes a difference.
Makes you realize those knees are pretty amazing, huh?
You really are.
And that about wraps up our depth dive into the world of knees.
It's been fun.
Totally. We hope you learned something new today and maybe even feel a little more grateful for those incredible joints that keep us moving. And remember, next time you take a step, think about all those parts working together. It really is a symphony of motion. Thanks for joining us on this deep dive, and we'll see you next time.